God, baby, what are you doing to me?
Oh, hello. I didn't see you there. I'm Scott Fox, lifelong insurance nerd. Welcome to my live stream. Today we're diving deep into prescription drug coverage, both standalone Part D and Medicare Advantage prescription drug plans. This is where so many people get confused and end up paying way more than they should for their medications. If you're trying to navigate the Medicare prescription maze, you're in the right place. All right, let's get nerdy. First question. What prescriptions trigger the highest out-of-pocket costs? Well, brand name diabetes medications like Ozempic, Mounjaro, they're huge culprits. Blood thinners like Eliquis and Xarelto, they also can hit your wallet kind of hard. Cancer medications, MS treatments, they all can reach that specialty tier with coinsurance rates of 25 to 33% instead of a flat copay like your tier 1 or tier 2 medications would have. And surprisingly, some common medications like certain statins and inhalers can vary wildly in cost between plans. So my first nerd tip, always check your exact dosage and form to make sure it's covered. Extended release versions often cost more than immediate release, and these things aren't interchangeable. You have to take the med that your doctor has prescribed to you. So looking ahead to 2026, the new $2,100 out-of-pocket cap will be huge for folks who are on expensive medications, but plan premiums are probably going to rise in the future. So anyway, the cap means you'll want to focus more on premium and formulary placement rather than catastrophic coverage benefits. So, drop your questions in the chat. If you want me to speak to specific examples, I'll get to the Q&A later in the live stream. All right, question number 2. Where do insurance companies hide the biggest gotchas? Well, it can seem like insurance companies want to get you sometimes. So, in the fine print, of course, you know, the large print giveth, the small print taketh away. But I'd have to say pharmacy networks. Absolutely. Most plans have preferred and standard pharmacies with huge price differences between them. Sometimes double the copay at non-preferred. Quantity limits are another trap that people don't often realize. They might be used to getting a 90-day fill, and that's going to cost them a lot more because the drug plan might only cover your drug for a 15-day supply instead of 30 or 90 days. So, Medicare Advantage prescription drug plans, they often look cheaper up front, but they may have more restrictive formularies than a standalone Part D plan. Now, if you're going to go the Medicare Advantage route, you can't have a standalone Part D. That's only for Medigap plans. Or if you're flying naked, without a Medigap plan and just using your regular Medicare Part A and B. Another thing to watch out for are step therapy requirements. So, step therapy sounds nice. Sounds like some kind of new exercise fad, but it's not. Step therapy forces you to try cheaper alternatives before covering what your doctor prescribed. So if you look at the plan and you see the little ST next to your med, don't just think, oh, good, my med is covered. No, it means that you need to try the cheaper med in the same therapeutic class. Then you have to report that that med doesn't work. Then your doctor has to re-prescribe the more expensive medication. So step therapy is a pain. Try to look for formularies that don't have ST next to the meds that you take. So my next nerd tip is the lowest premium plan might not be the lowest total cost. Always focus on your lowest total cost over the course of the year. Look at your specific drug costs for the entire year. Use the Plan Finder tool on Medicare.gov. It's gotten really good. And make sure to use your exact drug list. Take all of the specifics from the bottle to see your true annual costs, not just the monthly premium. And remember, if a med isn't on the formulary and you have to pay cash, it doesn't count towards your annual out-of-pocket maximum. All right, question 3. How do specialty tier medications get approved when prescribed? It is a bit of a process. So these high-cost drugs often require prior authorization. That means your doctor must submit clinical justification. The process typically starts with your doctor's office sending documentation proving you need this specific medication to the insurance company. The plan reviews against their clinical criteria, which can take anywhere from 24 hours to 14 days for a decision. So start early. If approved, you'll typically get a 1-year authorization that needs renewal. So mark your calendar to start early. My next nerd tip, create a prior authorization packet. You want it to have your diagnosis, your failed previous treatments, and clinical reasons for the medications. If you do have to appeal a rejection, the fastest route is having your doctor request an expedited review based on medical necessity. Now, here are the magic words. Repeat after me. My patient's health will be in serious jeopardy. Once again, my patient's health will be in serious jeopardy. Those are the magic words. This can reduce the 72-hour standard to a 24-hour review. All right. Question 4. Which discount programs work alongside Medicare coverage? So I get this question a lot. Good RX and similar discount programs, they can't be combined with your Part D or your MAPD benefits. It's one or the other. Also, most manufacturer assistant programs like copay cards can work for commercial plans, but typically not for Medicare beneficiaries. Now, the exception to this rule is patient assistance programs, or PAPs. These are from manufacturers that are specifically designed for seniors with limited incomes. Also, you want to look at some retail pharmacy loyalty programs. They offer genetic medication discounts that might beat your Part D copay if you pay cash. But be careful with paying cash, because remember, the cash that you pay out isn't going to count towards your annual out-of-pocket maximum. So kind of take that into consideration when you're looking at paying cash for a medication instead of the higher rate that you would pay through your plan. So for high-cost medications, always check if the manufacturer has a Medicare-specific assistance program before assuming that you'll have to pay full price. So before your next refill, call both your plan and the manufacturer support line to explore all possible savings programs. So go ahead and drop your questions in the comments so I can cover them next. And if you're watching this after it was live, you could still drop a question in the comments and I will answer them in the comments section. If this helped, please like this video and subscribe for more insurance nerd wisdom. If you want personal help, go ahead and book a consultation using the link in the description. And if you'd like a personalized review of your prescription costs, upload your medication list, and I would be happy to help you. Okay, thank you very much for watching. I'm Scott Fox.
Help me out here,
And I'll see you in the next video where we'll cover some more Medicare mysteries. And as always, stay nerdy, my friends.
Help me out here, Mike. Can you count it?